class. I'm Jeannie. I'm the Med-Surg charge nurse. All right, Med-Surg nurses, today we are going to be informing Nursing 101 students about our jobs. We all make roughly $70,000 annually, and according to the Bureau of Labor, jobs in our field are expected to increase 19% in the next 10 years. You are grouped together based on the information you are supposed to share. So let's all make sure that we share pertinent aspects of our everyday lives as Med-Surg nurses. Med-Surg nursing is a very large and diverse field of nursing, so I'm sure you have a lot to tell us. Why don't we start with Group 1 nurses Maddie and Maria.
Hi, my name's Maddie, and before we get started into what Med-Surg nursing is all about, we need to first cover what it takes to become a Med-Surg nurse. Before you can be a Med-Surg nurse, or any nurse at all, you must first have your RN license. This means you have attained either an associate's degree or bachelor's degree and passed your NCLEX licensure exam. After having your RN license, it is not mandatory to have a specific certification to work on a Med-Surg floor. However, this is a very competitive field and job environment, and it would likely help your chances of getting a job offer if you do obtain a certification. There are a couple of different certifications that you can choose from, one being the Registered Nurse Board Certification Credentials, RNBC, which is offered through the American Nurse Credential Center, ANCC. Maria, would you like to share the rest of our information?
Of course. Another certification is the Certified Medical Surgical Registered Nurse Credential, which is offered by the Medical Surgical Nursing Certification Board. Before you're eligible to get these two licenses, you must have obtained your RN license, have 2 years of RN experience in a medical surgical setting, and have 2,000 hours of practice in a med-surg environment. Also, to qualify for receiving the RNBC credential, you'll need to have completed 30 hours of continuing education courses within the time frame of the last 3 years.
That was great. Excellent information, Group 1. Thank you. So to review their information, you must have your RN license to be a Med-Surg nurse, and while it's not mandatory for you to have a specific Med-Surg certification, it will help your chances of getting a job. Now Group 2, nurses Michaela, Awel, and Luke. What information do you have to share with us?
Hi, I'm Nurse Michaela. We've gathered a lot of information about Med-Surg nursing for you today. We've gathered information about where it's practiced, what Med-Surg nursing involves, and the skills that are valuable to have as a Med-Surg nurse. Med-Surg nursing is practiced in a hospital setting in the medical and surgical units of a hospital. Since Med-Surg nursing includes such a broad spectrum of care, Med-Surg nurses will naturally encounter a very diverse patient population. This is especially true if the Med-Surg nurse works in a small rural hospital. This type of nursing was once thought to be a good place for nursing students that were fresh out of nursing school to start, since it provided such a large range of cases. This would provide the student with a good knowledge base and allow them to see many different scenarios. Nurse Awel, would you like to share the rest of our information?
Sure. Hi, my name is Awel, and because this type of environment that Med-Surg nurses work in, they perform a very diverse range of tasks. These can range from performing patient assessments, reading rhythm strips and labs, inserting IVs, cleaning wounds, educating patients and families, and collaborating with other members of the healthcare team, such as CNAs, LPNs, and doctors.
Now we'd like to show you some practical applications of Med-Surg nursing practice.
Hello, I'm Nurse Luke, and I'm going to take your pulse today. Can you tell me your name and date of birth, please?
Yes, my name is Awel Jenkins, and my birthday is October 27th, 1998.
Okay. All right. Can I have your wrist up here?
Sure.
And I'm just going to count for a minute. right, thank you, Ms. Jenkins, and I'm going to go document this in your chart.
Thank you.
Hi, I'm Nurse Jeannie. I'm here to take your blood pressure. Is that all right?
Yes.
Can you give me your name and birthday?
Yes, my name is Will Jenkins, and my birthday is October 27th, 1998.
Great, thank you. Just rest your arm. Thank you very much. I'm going to go record this in your chart.
Hi, my name is Nurse Maddie, and I'm going to demonstrate how to properly take off contaminated gloves. First, you're going to put them on. You're going to do what you need to do. They're already contaminated. There's blood, feces, whatever. Then you're going to take the palm of your hand. You're touching it outside to outside. You're going to pull, wad it up, take 2 fingers, go on the inside of the glove, fold it over, and then throw it in the trash. And then you're good. Wash your hands.
Hi, Nurse Maria, and
Michaela.
so we're going to teach you how to properly disinfect a wound. I don't have a wound right now, but if I did have a gash on my arm, this would be how to properly disinfect it. Okay, what would you like to do?
I would. First, you're gonna put your gloves on so you can avoid contaminating the patient further or yourself. You gotta put them on very carefully. Okay, then you're just gonna grab an alcohol swab, tear it open. The gauze won't tear, so just tear it straight through the middle. Take it out, rub it on the skin for a while. Make sure you get a big radius around it to make sure that you kill all the germs.
Hi, I'm Nurse Luke. In addition to the skills that med-surg nurses must have that are healthcare based, they must also have great organizational skills. This is a very high-paced, diverse unit of a hospital, so med-surg nurses must be able to prioritize and get things done quickly and efficiently. While this might sound like a stressful situation to some, the bright side of working in this unit is that you will never confront boredom while on the job. Working in this unit will also give you a great base of knowledge that you can apply to the rest of your career as a nurse.
Great information, Group 2. Now to review their information. Med-surg nurses work in the medical and surgical units of a hospital, and due to these being such large units of a hospital, they will encounter a very large range of different cases. Med-surg nurses have the ability to perform many different tasks, such as performing patient assessments, reading rhythm strips in labs, inserting IVs, cleaning wounds, educating patients and families, and collaborating with other members of the healthcare team, such as CNAs, LPNs, and doctors. In conclusion, med-surg nursing is a very diverse and high-paced field in healthcare. It requires specific education and preparation, continuing education, and certain specialized skills to be able to work as an effective med-surg nurse. While this is a very high-paced and ever-changing environment within a hospital, it gives you a great knowledge base that you will be able to pull from for the rest of your nursing career. Now go out and be great med-surg nurses. Thank you very much for watching. This presentation was made possible by Maddie, Michaela, Luke, Owell, Maria, and myself, Jeannie. We hope that this presentation has greatly informed you about the field of med-surg nursing and what a rigorous yet exciting field it is. We hope that maybe this showed you whether or not that this is the field of nursing that you would like to pursue after graduation. Best of luck to all Nursing 101 students with this class and beyond.